Sometimes you just need to get in the bath.
Sounds like a title for a book you could write. Sometimes you just need to get in the bath.
And other stories about my life.
And welcome back
Oh my God.
to Dad, Did We Just Break America?
I'm Skylar, your exhausted Gen Z doom scroller. I have no time to scroll. I want to go to bed so bad.
And I'm Corey, your cynical Gen Xer. So why are you so exhausted?
It's my last week of my first semester of grad school. I just finished a huge assignment today, but I've been working on it for 24 hours straight at this point.
Just a whole 24 hours?
No
breaks? Not at all?
No break.
You go to the bathroom?
No, that's different. I take spirulactone, so I have to go to the bathroom more than
It's way too much information for everybody else.
to go to the bathroom more than the average person.
We have something in common.
Okay, well, for different reasons.
Yes, exactly.
I'm on a diuretic.
My whole life is a tirade. So Sky.
Yeah, and since I was focusing on this big assignment, I didn't start or finish my other assignments that are due tomorrow and Wednesday.
So what are you doing the podcast for? Why can't you be doing that?
Because I'm okay.
You sure you're okay?
I'm fine.
You're okay?
Yeah, I'm going to take a bath after this. I deserve it.
You deserve it.
Yeah.
Interesting.
It's important to treat yourself. I treat myself to a bath every day.
Not a shower, just a bath?
No, both, but I like to lounge in the bath. It's good for your soul.
I don't bathe.
When I was writing this paper, when I had writer's block, I just turned the faucet on and get in the bath and close my eyes for a second. And it would all come back to me. Now, sometimes writer's block isn't that simple, but sometimes you just need to get in the bath.
Sounds like a title for a book you could write. Sometimes you just need to get in the bath.
And other stories about my life.
Exactly.
Bookstores near you soon, ladies and gentlemen. Are there bookstores near us anymore?
So one of the things we should talk about is one of the things that helps you do this writing, which is?
Oh, my Adderall.
Which is extremely hard to get nowadays.
Yeah, I think I've mentioned this before. There's been an Adderall shortage since I left for college. Or before.
Right, which I think is really like a self-made pharmaceutical thing.
Well, how is there, you just produce more?
There's a lot that goes into the production of medicines.
No, understood, but how long could it, you've been trying to solve this issue for what, 6 years? 5, 6 years?
Well, there is a supply chain issue, and obviously a lot of the things that go on in the world don't help that.
Yeah.
But the whole healthcare system, and what I really wanted to bring to the forefront, as somebody who has a couple of ailments and I've been going through or trying to go through some additional testing, the healthcare system is kind of broken. And it's been broken for a long time, and there's really no way.
F Luigi about it.
Well, I understand.
Sorry, that one.
I know, really. I understand the frustration with the healthcare system.
Yeah.
I'm not saying you should go out and start shooting people.
No, maybe you should
call
a lobbyist.
Although I do understand the reasoning behind that. Okay. Not that I'm saying that you should be shooting people. I do understand being frustrated about it, because I'll give you an example. I've been taking different medications for an ailment, and medication I was on wasn't working correctly. I recently went to another doctor because the original doctor was kind of semi-retiring, but his support staff, and what I think has happened in a lot of the medical genre is what? Could I get this point out before
I wasn't interrupting. I was just saying excitedly.
What has happened is a lot of these groups have gotten much bigger, and a lot of doctors are together or in some kind of hospital setting where they kind of work for the hospital type of thing.
Yeah.
Or a medical practice that's inside a hospital.
Yeah.
Basically what happens is they all work for the hospital. And in working for the hospital, they get their office space. The hospital pays for their malpractice insurance, and they get support staff. So they don't really have to have overhead costs.
So the support staff isn't theirs.
Support staff is hospital based. That's correct.
Great.
And that's part of the problem.
That's the problem. I didn't know this, and it makes a whole lot of sense.
Because the problem is that at the former doctor I was at, who wasn't around a lot because he was semi-retired, he didn't understand the frustration that I was having with his support staff.
Yeah.
Because they could care less to you. To them, you're a number. And they'll get to it when they get to it.
Yeah.
And this is the big increase. And one of the reasons why I'm talking about this is a lot of people are very into the concept of, and it's very big in higher socioeconomic regions, of concierge medicine, where, you know, the doctor doesn't take health insurance, and you pay the doctor a monthly or annual fee.
Must be nice. To
see you and to, you know, be at your beck and call. And that's where medicine is going. It's been going that way probably for 10 years at this point, 10 to 15 years. So concierge service is, you can call the doctor day or night, ask a medical question, text, phone call, whatever the story is.
Yeah.
Get whatever thing you need to get. If you need a prescription refill, or if you need to come in and have something looked at, or you need a virtual visit, you're not feeling well, whatever the story is.
Yeah.
And while it's great, it's expensive, and everybody pays for health insurance, or some people get it through their job. And
some form of something.
Right. But you still pay for it because a lot of companies only do partial reimbursement or whatever. So health costs have gone up and are skyrocketing. And we are supposed to be the most civilized country on the planet.
Yeah, but we're also the most unhealthy.
And again, not only are we the most unhealthy, we have the highest some of the highest healthcare costs out there.
Do you think we should socialize medicine?
No, I don't think that's the answer either, because socialized medicine hasn't worked in any country that has it.
Well, socialism hasn't worked anywhere.
Well, socialized medicine and socialism are two different things.
Okay, well, we should stop using socialized.
Yeah, they're two different things. But in Canada, the UK, Italy, places that have socialized medicine, where they pay a higher tax bracket, right? They pay a higher tax rate because everybody has the same health care. Now, while that makes some sense, okay, people who really need to get an operation or need to go see a doctor really don't have the capability, or it has to cost them a lot of money.
Yeah, it's a problem.
And it's not a foolproof science. So that doesn't really work as well as it's supposed to.
But they make it sound really nice in school. I will say they have a great marketing team, whoever's doing it.
Well, it makes sense, or the concept makes sense.
On the surface.
Well, that is, let's just say that you live in New York State, right?
Yeah.
So you pay probably one of the highest tax rates in the country. Not the highest, but pretty close to it. What services do you really get? You pay for everything that you do. You go on the subway in the Manhattan, you pay for it.
Yeah, I get
nothing. You take a bus, you pay for it, right?
I get nothing. It really is depressing when you think about it. What are we doing? We're a bunch of buffoons.
So the taxes that you pay, what do you get out of it? You get the federal government. I don't know if that's such a good thing. And
you get a shirt that says, "I love New York," a nice slice of pizza, and the ability to say you live here.
And right. And how much is the subway now?
$3.
$3 will get you uptown one way. So
it gives me anxiety when it when I tap and it says $3. I'm like, isn't that a lot?
Well, compared to when I was your age, yeah. But everything has to go up.
No,
right?
but it's not a nice experience. So if you made the experience nicer, I'd be willing to pay more.
In any
but
event,
I'm cheating death every time I take the subway.
I'm cheating death. That's right. That makes me feel all the better.
It's a joke, Dad.
Is that a story with a humorous climax?
Yes. Haha. Funny. Haha. Funny. Oh.
Anyway.
I already cracked them today.
So the concept, though, in socialized medicine sounds great. Doesn't really work well.
But it
But
sounds great until you dig deeper.
But this situation doesn't work well either.
No.
So I had the one doctor where I tried to get an appointment. It took forever. I tried to get a medication change, and that was almost like you probably could have gotten an audience with the Pope faster.
I'm sure you could.
So I then went to another specialist for the same thing, who somebody else recommended, and the specialist themselves gave me a whole soliloquy about how in their practice, another hospital practice in our area, in their practice, they should all go nameless for the moment. In their practice, they have to respond to messages from patients, and they have to have a certain patient level of satisfaction, or else they have a problem.
It doesn't seem
okay.
It
So
goes that way in practice.
No, it sounded good coming out.
No, it sounds beautiful. You're so happy.
Right.
You're
it
buying the
sounded like
t-shirt,
okay,
lifelong membership.
Right. Like, okay, here's a specialist who knows what they're doing, says, let's go do these tests because we want to see what's going on.
Who has some bedside manner.
And
allegedly.
Well, they didn't have a great bedside manner anyway, but that's a whole nother topic. And then that individual was reminding me that they have to respond to messages from their patients. So rest assured, because I had complained, they asked why I was leaving the other specialist, and I was complaining about, well, I was, getting treated like my name was Stanley in the lobby instead of I'm your patient. And I'm just asked, by the way, I'm not asking for you to cure a major illness.
No, I'm just asking you to treat me like I'm not a farm animal.
Right. I'm not asking for you to reinvent
like,
the
it's
wheel
weird.
for me. I'm just asking to get the level of service that anybody would ask to get. If I send you, they all have these apps, right? They all have these practice apps.
Yeah, like my chart.
Right. And they say, okay, so put a message into the app.
No one ever looks at my messages.
Well, that's the whole problem.
Like, is anybody reading this, or am I chatting with myself?
So then I met with this new specialist, and this new specialist said, don't worry, we're going to respond to anything. Let me fill a prescription now, but if you want to try something different, or these other options, just send in a message. We'll take care of it.
Right.
So last week, I decided, okay, the medicine he gave me is not really working out so well, what he suggested. And there was another one that I had already had. So I said, maybe I should try this other one. So I put in a message, okay? I don't know, had to be 8 or 9 in the morning. I wait a day, no answer. I wait another day, no answer. I wait another day, no answer. Then it's the weekend, so Friday afternoon at p.m.
They close.
No, they're already closed. I get a text back on the app. The doctor has gotten your message, and as soon as the doctor puts in or refills your prescription or puts in the prescription for the new medicine, you'll get an acknowledgement from the app.
Thank you so much.
And it says at the bottom of it, no joke, I'm not kidding. It says, do not respond to this message. Because no one's going to respond to this. This is an unintended message. Yeah. Now, it's automated on the app where you told me to send you messages. But the message coming back from you said, don't respond to me.
Yeah, so.
Does anybody else have a problem with that?
I'm just confused.
Right.
And can I speak to anybody?
Well, they have a phone number.
Yeah, and then you have to sit on hold, and then they'll decide to hang up.
I'm going to take it up a notch because this is great. Okay, it's going to get better. So I'm supposed to have this test.
Yeah.
So I have the test scheduled. They got me in for the test to be done. An email from the insurance company that the test has been denied. Now, one assumes that at this great big hospital practice, right, they've dealt with an insurance company once or twice before.
I'd hope.
Maybe 100,000 times before?
No, I really hope. Once or twice, at least, I'd hope.
So,
one could hope.
But I'm sitting there, and I'm looking at the insurance company, what's called an EOB, explanation of benefits, which, guess what? You don't have any benefits.
Thank you.
Okay.
Thank you.
So, well, because they denied it. So now I'm sitting here going, I don't get it. These are specialists.
This is like your job.
Who deal with this every day. Now, insurance is part of the issue in the medical world, right? So I read the letter that denies me, and so nobody from the practice group tells me that the test was denied.
You know, they're waiting for you to reach out to them
Why?
because they can't be bothered unless you raise it as a concern. They're not going to bring it up,
And then there's an
wild.
estimate on the
The same email, like on the message.
there's an estimate of what the test costs.
Okay.
And of course I look at that and I go, like, holy shit, man. Like, how the hell, like, where do you come up with that number?
Yeah.
Okay, again, you know, that's a whole nother topic of why things in medicine cost what they cost, right?
Yeah,
Which is part of the reason why you can't get medicine that you need, is because of all this different red tape and all these different ingredients and different things that most pharmaceutical production is actually being controlled.
Mhm.
And that's part of the problem. So in any event,
Who's controlling it though, and who can we speak to about it?
well, the pharmaceutical companies control it. And then there are some pathways that are opened up by generic drug manufacturers,
But not enough.
but not enough. So my test was denied. And then I had to call,
Yeah, it's ludicrous.
but they don't know that it's denied.
Yeah, because that person didn't open their email.
Wait a minute. How do you not know this? You get the same paperwork I get. You know, it's still not approved, but it took a couple of days to get somebody to get back to me to talk about, oh, wow, it shouldn't have been denied. You're a patient with this issue, so this is a standard thing.
Thank you very much.
I know I have to be my own advocate, right? In today's world, you have to be mindful of what a doctor is telling you to do, because you have to think about it. Maybe I want to do that. Maybe I don't want to do that. Maybe I need a second opinion.
Yeah. No, but like, to what extent do I have to be my own advocate? Do I have to do everybody's
Well, I didn't
job?
go to-
That's not an advocate.
Right. I didn't go to medical school, so I'm kind of asking you to do what you're supposed to be doing
Yeah, you have
and be
to,
a
like,
doctor. This whole entire time where I'm talking to them about the test and fighting over, well, you want me to keep the appointment, but I don't want to get to the appointment where I have to go take the test, and then you're going to want me to pay for it.
Yeah.
Because this is what I have health insurance for, right?
Mhm.
This whole time, nobody has filled my prescription yet. But then meanwhile, I have an allergist, right? So I had an allergy issue because allergies have been really bad.
Yeah, there's more pollen in New York City, they say, than ever before anywhere.
Okay. So my
don't know if
allergies
it's
have been bad, and I have like a little ear problem.
Oh, no.
Like I have, you know, like a little, you know, not an ear infection, but like my ears got clogged. So
That's an allergy thing.
it can be. So I had to go to the allergist. So I went to the allergist. I want you to know the allergist and I sat and had a great conversation about medicine and how horrible it is. And I felt bad for her that she does allergy shots in immunology.
Mm-hmm.
And I'm not good with the allergy shots. I do them sometimes. I don't do them. I'm not consistent.
But she made you feel so bad that you're going to go consistently now?
No, she made me feel bad. She said some insurance companies only pay her $5 or $10 per injection.
Wait, what?
Right. That was my reaction. I said, how is that even possible? How does that even cover the cost of producing the allergen, the syringes, and all the different stuff?
It doesn't cover the cost for one of those in this economy?
Right. And she's in New York City, and she has staff, and she has office space, and
Mm-hmm.
what have you. She's been in business for a long time. And she said, you know, she said to me that when they only get $5 or $10 per injection, they're fighting over the amount of money that they bill an insurance company that they get reimbursed. It's like, you know, I might as well drive Uber because I don't have to go to school. She said I went to school for
150 years.
Yeah, I mean, she's, you know, double board certified
Mhm.
or something. So she went to school for 8-10 years in
Mhm.
medical school after college. And not that
This
she's
is depressing.
not that she's not making money, but she can't make money. Like a cardiothoracic surgeon makes money, a plastic surgeon makes money, that's all cash.
Yeah.
But it's ridiculous what we reimburse doctors for on health insurance. And the health insurance crisis is a crisis that goes untalked about and nobody really discusses it.
Well, I don't think anybody's ever, I don't think I've ever heard anybody discuss it from this point of view, and that's unacceptable. Like this person is still like, yes, we all pay a lot of money for health insurance, this, that, and the other thing. But this person is also doing a job.
I thought it was the craziest thing I've ever heard in my life. But the point of me bringing
I
up
tip my Uber driver more than that.
Okay, the point of me bringing up the allergist is I saw the allergist, her last appointment, because I had to get in because my ear was clogged.
Yeah.
Last appointment was 4:30 on a Friday.
I remember.
Or 4:45, something like that. I sat there speaking to her about what was going on with the specialist, different group than she knows, but what was going on with the specialist. We talked for about a half an hour to 40 minutes about medicine.
Mm-hmm.
And she was telling me about what's really going on. And I left her office at 5:15.
Mm-hmm.
By the time I got home at 6 o'clock, my prescriptions were already in from her and filled.
Your allergy prescription.
Correct.
Yeah, like it's not that difficult.
How was she? Now I understand it was the end of her day, and but she still had a lot of work to do. She wasn't leaving her office for another hour or two.
No, it's not that difficult.
But the prescription was it's all electronic.
Right, and it's not like they're missing something in the back of CVS.
Nobody's writing a prescription for you and handing you a piece of paper that you then have to go cart over to CVS.
No, but also, why does it take so long?
Again, it's all because we have relied, and you're going to get mad now. Ms. Doomscroller is going to get mad at us, or at least at me. But we've relied on technology to the point where this is how we want patients to contact us, but nobody's paying attention. And this is where AI could come in very helpful.
Yeah.
Because AI, I'm not asking AI to do the prescription for you. Because you still need a licensed individual in order to issue a prescription for medicine. AI could sift through the emails or the texting
and say like, this is urgent, or this is not.
Or say what's urgent or what's more urgent, or which patients need to be responded to.
Yeah, like I'll call my doctor like 2 hours after I send one of those messages and I have to send a follow-up message after my appointments because I have to call a bunch of pharmacies and find who has my medicine.
But why is that your job?
I don't know. But it's a full-time job.
See, that's an AI thing where AI should be able to tell you who has the medicine in your area.
Yeah, and every time I look it up and see if there's an application for it, it's like, yeah, and it's like $70 a month. Like, really?
But that's something where AI should be able to tell you that.
Yeah, I shouldn't have to sit on the phone with every pharmacy.
So what's the fix is the question.
I don't know. This is not my area of expertise. But I think like a good thing is talking about it. I feel like I learned things that I didn't know just now.
And the problem is now that, okay, so I have to speak to another. Now, I'm going to take a step back. When I was speaking to the hospital practices customer service department, they have a customer service department.
Right, and that's fun.
But they sounded like the cell phone company's customer service department.
Yeah, it's a joke.
No, it actually sounded like there were people in the customer service department that weren't here. It sounded like they were taking...
Yeah, they're somewhere else.
It sounded like they were taking my call in some other municipality or another country or whatever.
Yeah.
I spoke to the customer service people. All they did was take another message.
Yeah, and they're going to get back to somebody else after the time zone.
So it takes...
Because they're 17 hours.
Now, that made me scared that... No. It made me scared that a health system had a customer service department that was farmed out somewhere else, was not even here.
Yes. What about like my doctor? Remember, I couldn't get my medicine a couple years ago, and the weekend service was like just somebody that they paid to like answer their phones for emergencies, and they told me that based on the guidelines they were given, that my issue wasn't an emergency. If anybody knows anything about taking Adderall, like you can't just not take it.
Well, that's what this medicine is too.
Right. So
You
like
have
it
to-
actually is an emergency.
You have to take something. Now, I understand they don't deem it to be a medical emergency. I'll put that in quotes.
Yeah, but I do.
Okay. They don't deem it as a medical emergency because you're not going to die. Now, at the other specialist's office, when somebody else answered the phone or took a customer service message for me, I said, I don't know what you people are doing. This is the first specialist after, not the new one. I don't know what you people are doing, but this is not the kind of medicine where you could just forget about it. Or you'll wait until the doctor gets back to you. It's not a Tylenol.
Yeah.
I said, well, what am I supposed to do? I'm just supposed to go to the emergency room if nobody helps me? Literally actually said, the response to that was, yes, if you have a medical problem and you can't get help from your doctor, you have to go to an emergency room. But that's not the point of the emergency room. Obviously, something needs to be done about this medical issue because there is no possible way that I am the only person this is happening to.
No, me too.
And there is no possible way that that makes logical sense for everybody to have to deal with on a daily, weekly, and monthly basis.
No, for sure. It's like a little.
For sure.
It makes every month I want to pull my hair out when I have to deal with getting my medicine. And it takes like the entire day. It's kind of exhausting. Do you have anything to say?
So I think we need a new kind of healthcare system.
Why don't you go talk to somebody about it?
And I think that we need some kind of, and now somebody in their infinite stupidity in the health insurance company decided that a patient with my issues didn't need this test that now has to be appealed. You know, the decision has to be appealed, like a court decision.
Yeah, it's just like who did.
And what was the whole point of
The person wasn't paying attention.
or somebody filled out the form wrong or
Yeah.
had the wrong code down, right?
Yeah. It's like a human error.
But that's your problem.
We don't need to have the issue of human error. We don't need to do this. Go do other things. They all complain that they're overworked and underpaid.
Well, everybody does today, I think.
Yeah, but like, so you have the robot in your computer, go do that. And you can.
This is our issue. We all expect something right away, but
We're too used to instant gratification.
medicine is behind the times
Yeah.
because things take too long in medicine.
And then they're like, well, your doctor's in with another patient. They're going to have to get back to you. My doctor is on her computer. She could open another tab and send my prescription in. I don't understand the major malfunction. I'm sorry, I don't.
Exactly. So, Sky, I think America's broken. I think our healthcare system is kaputs.
It has been for a while.
And we do some major medical advancements, but I really don't believe that we're hitting the mark on this stuff anymore.
No.
Thank you for joining us and listening to my diatribe on healthcare in the United States.
Thank you for coming to my TED Talk.